Vamos lá. Oh, hi. I guess we are live. We are live. YouTube says we are. Okay. So this is April the 17th, 2024. We are live. My name is Galvani. Welcome to the channel. Today we are going to read a abdominal CT scan. This is a very interesting case. This is an elderly woman who complains of right-sided pain, abdominal pain, for about 2 weeks. She also complains about mild fever, and she has noticed recently, on the past few days, that she has some yellowish tone in her eyes, as if she had jaundice. So this is a elderly woman with abdominal pain, right-sided abdominal pain, jaundice, and fever. So let's get to the exam. I guess this is it. Yep, it's working. So just as a quick recap, if you are just starting out in this CT and MRI scanning practice, this is an axial scan. This is the original. These are the original images, axial images. So this is a cross-section exam that we scan from top to bottom, from the head to the toes. The patient is lying down in a supine position with the belly pointing to the ceiling, and the scanner makes cross-sectional images from about the base of the lung to the floor of the pelvis. So we get this kind of images like that. These are sectional images. This is the heart. This is these are the bases of the lungs. So we have to understand that this is the front of the patient, the ventral portion of the body. This is anterior, so this is posterior, so supine position. This is the scanning table. This is left and right. It's as if we were sitting down at the sole of the patient's feet, looking towards him or her in this case. So this is it: left, right, ventral, anterior, dorsal, or posterior. So this is the left kidney, and this is the right kidney. This is the spine, and to the right is the liver, and to the left it is the spleen. So this is the gastric fundus. So we have an elderly woman complaining about fever, jaundice, and right-sided pain. What could we think about it? What should we look for? So if it's fever, jaundice, and pain, we are talking about some kind of biliary disease. It's an obstructive disease of some kind, or maybe a lesion, liver lesion, that could cause the accumulation of bilirubin, I guess this is how we say it in English, which leads to jaundice. So we are looking for causes of jaundice and fever in elderly patients. So right off the bat, we can see that the liver is heterogeneous, it's strange. This is a non-enhanced sequence, and this is the post-enhancement sequence at a portal phase, which is about 90 seconds after the initiation of the infusion of intravenous contrast. So about 90 seconds, we get this kind of image, the portal phase of the liver opacification. The liver should be really bright compared to the pre-contrast phases, so should be the kidneys and the spleen. So this is what we have here. We have a very heterogeneous liver due to a bunch of coalescent hypoattenuating lesions, ill-defined and hypoattenuating lesions. What could be this? So as we inject contrast, we should first of all check, since this is a liver exam, we should have a arterial phase of enhancement, which is much more early than the portal phase. This is ideal if we are looking for solid masses, liver solid masses, and pancreatic masses. So if the lesion is hypervascular, it is primarily enhanced by contrast on the arterial phase by the arteries, liver arteries. So our lesions, ill-defined, hypoattenuating, and confluent coalescent lesions of this liver liver disease aren't really enhanced at this phase. So this is not a hypervascular lesion. On the contrary, if we get the portal phase back to the workstation, we can see that the ill-defined lesions are much better defined in this phase of enhancement, mostly because the liver is pretty bright and the inside of the lesions are liquid, are fluid, so they won't enhance. So let's just measure this lesion after an enhancement. It measures 11 HUs, which are Hounsfield units, a unit of measurement of attenuation, X-ray attenuation, and pre-contrast, it's quite the same attenuation. It's 11 Hounsfield units. So there was no particular enhancement of the interior of the lesions. There are also incomplete septations, irregular margins, and the lesions tend to be confluent. So we have here a bunch of ill-defined lesions, confluent, coalescent lesions, liquid mostly, with thickened borders and incomplete septations. In the clinical setting that I described, considering this is also in elderly patients, the most probable, almost 100% certain diagnosis here is a huge, massive liver abscess. This is infection. This is necrotic liver, multiple necrotic infectious liver lesions making a huge abscess. As a bonus, we can see right here, this is the gallbladder, and this is a large stone, partially calcified gallbladder stone. It's over 21 millimeters in size. Also, we see here a bunch of simple kidney cysts, which we call renal kidney cysts. So renal cysts, kidney cysts. We also have some calcification, some vascular calcification on the aorta. We also see some lymph nodes at the hepatic ileum, which are pretty common in this setting, this infectious setting. Oh, this is not a female patient. This is a male patient. I'm sorry. This is a male patient. I just realized there is a prostate here. So I must be confusing it with another case I recently reported. So this is my case. This is my case from my practice. I saved it to, exactly. I saved it to share with you guys. So and we also have a duodenal diverticulum right here. So this is it. This is a liver abscess, also a gallbladder stone in an elderly patient with jaundice, fever, and right-sided abdominal pain. So I hope you liked it. If you did enjoy this video, please leave the like, hit the like button, subscribe to the channel. I'm planning on live streaming a bunch of times, almost every day, as much as I can due to my day-to-day routine as a radiologist that works from home and from the office. So I mostly do work from home office, and from my own office. I don't really go to the hospital, nor the clinic anymore. So I have a little free time, and I just thought I may start streaming this kind of exams. And if you enjoyed this kind of streams, like, subscribe, and share this video. It's a great help to the channel. So until next time, take care. See you around. Bye-bye. Oh, check this right here. Check this other video right here. Thank you. See you.